this is MLO view. So there are two views of the mammography here. Here you can see one tumor here, just close to NAC, nipple areola complex. And there is a microcalcification just behind that. And medial to that, there is a one more microcal here. So there is a tumor with microcalcification just posterior to the tumor involving NAC, and there is at least 2 to 3 centimeter away, there is a microcalcification on the medial side. So our excision volume will be around 5 into 5 centimeter. And if we include 1 centimeter all around, it's 6 into 6 centimeter excision volume. After surgery, so we are planning breast conservation surgery here with chest wall perforator flap plus CH palpable node. So we are doing axillary lymph node dissection. So we will remove this whole area including nipple areola complex. We will do axillary lymph node dissection and we will cover this defect with the either lateral intercostal artery perforator flap or lateral thoracic artery perforator flap. So once I will be with the patient, I will explain you the marking in the patient for the surgical marking.
Sure, sir. Thank you.
Yeah, so ER positive, HER2 negative. This is the tumor here, close to nipple areola complex. And it's involving the NAC